Hi, my name is Maria. I'm a final year med student at Cambridge, and last month I did my final exams. So these were my practical stations, and today I'm going to be telling you about what came up for me and what to expect in yours if you have those coming up. I wish I could have seen a video like this a month and a half ago, so hopefully you guys will find it quite helpful.
Okay, so first of all, I'm just going to start off with a disclaimer. So this video isn't intended to give anyone sitting OSCEs an unfair advantage or to encourage cheating. Most of the information that I've used in this talk is actually pulled from Cambridge's demystifying assessment talks, but I do point you towards things which I think are more important to prioritise than others. Most of the exam station themes that I do discuss are widely available online, for example, the Geeky Medics website and on the PACES website as well, when I talk about conditions which are more likely to come up than others. Of course, exam stations change between sittings and years, so just because something came up for me doesn't mean it will for you, or it won't. Like things change, so I would take anything with a pinch of salt. So this video should really help you focus your revision, and I hope it can reassure anyone who's anxious about facing these exams. I'm just going to go through the general structure of the exams. So there are 2 days of exams. There are the SCEEs, these are the communication exams, and the OSCEs, these are the practical exams. And you need to pass both parts to pass overall.
So with the practical exams, there's no chance to resit them. So you have your writtens in January time, but Cambridge for some reason only gives you your practical exams at the end of April. And so if you don't pass them, they make you redo the entire 6th year again, which I think is really annoying and frustrating. I don't like this system.
So I'm now going to go through the SCEE stations. So there are 7 stations of 15 minutes. So there are 2 explanation and planning stations. The exact scenario was sent 2 weeks in advance, so everybody in the year group will know this, and you can prepare for this as much as you like, and it is in your best interest to be very, very slick at doing this. For these, you get 1-minute reading and 14-minute interview. You get 2 difficult communication scenarios. You get 1 minute of reading and 14 minutes interview for both of those, and I'll go through what might or might not come up for that. And then you have 3 standard communication scenarios. So that's 1 minute of reading, 10-minute interview, and 4-minute viva. And you need to pass 4 out of 7. Since you have 2 stations already given to you, that would mean you only need to pass 2 more out of the 5 if those first 2 went perfectly. So I think that is quite a reassuring thing.
So for the communication session, they will tell you 2 of the stations in advance. So those are the explanation and planning ones. So for me, I had one where I had to explain a type of procedure called HOLEP to somebody with benign prostatic hyperplasia and kind of pitch that explanation to what they wanted to hear. The other one was a patient who was very anxious because somebody in her family had breast cancer, and counselling her about the risks of breast cancer, whether she was suitable for any screening, and trying to reassure her, which was actually very difficult.
Okay, so key communication stations. So these ones might come up in a difficult history. So taking collateral history from a family member. So for example, if a patient is very elderly, has a mental health condition, or as a child, you might be gathering information from someone else. Discussions about death and dying, including prognosis, breaking down the bad news about a patient's family member dying and how long they would probably have left to live, and answering any questions related to palliative care. Explanation about complex procedures. There are so many things this could be. One example was lumbar puncture. Picking up on red flags from histories and breaking bad news. This is a very popular difficult station that you should be confident in navigating. And the last one is health behavioural changes. So for example, ones related to smoking cessation, alcohol use, or diet are really relevant here. These are really difficult conversations to have in the first place, so it's a really good thing for them to test.
So the way it worked was you had 1 minute before you went in to read all of the information in front of the station, and this was often not enough time at all. So for a few of the stations, I really struggled because I didn't have all of the information that I needed. It turns out there is a sheet with the information in the station on the table, but when you're in there, it's quite difficult to figure that out.
I'm just going to give you an overview of the OSCE stations. So there are 7 stations of 16 minutes each. You have a practical skill station. There's a list which is sent in advance. You get 1 minute of reading, 9 minutes of your practical skill, and 6 minutes of either. You have an annual review station. So this will be a chronic condition. For example, asthma, diabetes, heart failure, and COPD. These are the ones I revised, and there is a set of documents in the Google form which is sent from older years. I can probably share those as well as part of the YouTube video. These are super helpful, and this is all I learned for that. Management planning. So this is either preoperative assessment or discharge planning. This is what the university says. And there's 1 minute of reading, 9 minutes of the exam, and 6 minutes of either. For this, I would just point you towards the fact that in 4th year discharge planning is focused on quite a bit. So since preoperative assessment isn't tested at any other point, that makes it quite a likely scenario. It's also something that you might be a bit more rusty on, so I would definitely focus on that. And then the next thing is the system examination. And for all 4 of these, it's 1 minute reading, 9 minutes exam, and 6 minutes viva. And of course, with these stations, they might include some sort of data interpretation. And you need to pass 4 out of the 7 stations to pass. Top tips. The diabetic foot is an examiner favourite, and that comes under the annual review. For this, you don't really ask questions, but you just examine a diabetic foot. It is essential that you are confident doing this because it is a popular station.
The discharge one comes up quite a lot in 4th year, so almost every time you're going to get the pre-operative assessment. So for this, you need to ask the patient quite a lot of questions, and then you need to do it like a head-to-toe examination as well all the time. So that's quite tight.
For the OSCE stations, the examinations can be an abdominal examination, cardiovascular, respiratory, cranial nerve, peripheral nerve, and MSK. And the university did specify that for the MSK exam, it will be a large joint, and that's shoulder, hip, or knee. I learned a lot of different MSK exams, and it wasn't really that relevant, to be honest, because they do specify what is going to come up. As I said, all of this information comes from demystifying assessment. Generally, they will tend to ask at least 2, if not all 3 of the big 3, so abdo, cardio, resp. They also tend to ask some sort of neurological exam. That might be cranial nerves or peripheral nerves. So what conditions will come up? Well, that is a very good question, and I guess I can't tell you what comes up and what came up for me. But of course, some things are more likely to come up than others. So in the Cambridge OSCEs, you're examining patients. So the patients need to be stable and they have to have reliable signs. So some conditions are therefore going to be overrepresented. So for one, they have to be stable, so you're not going to have any acute emergencies. There's not going to be sepsis, nobody's having a heart attack. They need to have reliable signs that are going to be present all day for all of the other students to examine them. So they can't just come and go, for example, asthma. They have to have a chronic illness. It can't just improve between them recruiting those patients and the actual OSCE, so like pneumonia or acute hepatitis. And they need to be able to consent to being a patient for OSCEs, and they actually need to reliably come to the exam. So they can't be delirious, they probably can't have dementia. It's unlikely that they're going to be an IV drug user or an alcoholic. So what conditions should you look for? So cardiovascular conditions, heart murmurs are really, really, really likely, as are prosthetic heart valves and atrial fibrillation. Other things are pacemakers, heart failure, previous cabbages, and previous surgical repairs of congenital issues. You really need to make sure you know your heart sounds and scars. Respiratory, interstitial lung disease is very likely, as is COPD. You could get asthma, bronchiectasis, and a lobectomy as well. And abdominal, so one that's really, really likely is a renal transplant, as is chronic liver disease. Inflammatory bowel disease is also pretty likely. Other things to consider are hepatosplenomegaly, liver transplants, and polycystic kidney disease. There's this website about preparing for the PACEs. They also use patients with signs for these exams, and for the cardiovascular stations, these are the ones that most commonly come up. For the respiratory stations, these are the ones that most likely come up. For the abdominal stations, these are the most common conditions that come up as well. For the other stations, for your peripheral neurological exam, thinking about peripheral neuropathies and, different causes behind those. Parkinson's is also quite common, as are nerve palsies. Cranial nerves, a stroke causing some sort of cranial nerve lesion is very likely. You could get multiple sclerosis. And then for MSK, osteoarthritis is likely. Rheumatoid arthritis could come up. Maybe a joint replacement. You can get other things as well, but those are probably the most likely. On this website about the PACEs, these are the ones that come up for neurology most often. So it is worth being aware of this when you're trying to target your revision. Of course, there are other examinations, and these might be worth thinking about. This comes from my Notion when I was preparing for OSCEs, because I did learn other exams too, but I do say how likely they are to come up, because some are a lot more likely to come up than others. And as part of those OSCE stations, you can get data interpretation. The things I would focus on the most are arterial blood gases, radiology reports, so x-rays of joints, chest, ECGs, that's going to come up for cardiovascular quite likely, retinal photographs, that can come up more for practical skills if you're doing ophthalmoscopy, pulmonary function tests can come up for that respiratory exam, and just general bloods, you should be familiar interpreting those. So with the OSCE stations, you also get one practical skill station. There is a massive list of things that you can get, and the station can be really quite tight for time. So I had suturing, and thankfully a lot of the equipment was already laid out. The thing is, these stations change from year to year, so you can't really read into it too much. Also, this station is lower yield. There are lots of options for skills that can come up, and you only get one. So I would prioritise focusing on your examinations and your communication stations over practical skills. You only need to pass 4 stations out of 7. This is the lowest yield part of the exam, in my opinion. Practical skills, my main tips are read thoroughly through all the information under the skills that are sent by practical tutors. I was really confused because I got asked about local anaesthetic doses, and I was like, that's insane. How would I know this? This was literally specified by the university, so you should read through that information. It's actually relevant. You can easily fail for a few things. So if you don't do patient safety checks, even if you do your skill really well, if you've done it on the wrong person, then that would be an automatic fail. If you don't communicate with your role player, for example, if you spend a lot of time setting up, that can be an immediate fail, and that happened for me in my 5th year exams when I was trying to set up some sort of drug administration. And for example, if you break aseptic technique, which could happen if you're doing a catheter, it is much better for you to just state this and say that you would restart and ask if they want you to restart, rather than ignoring it and pretending that it never happened, because you could just automatically fail for that as well.
So I think those are probably the most common things that you can expect in the final year OSCEs in Cambridge. There were some curveballs though, so not just the timing that was horrific for reading before stations, but also some of the questions in the vivas were quite difficult. I think obviously you're going to get some of the bog standard ones where you just summarize what you've seen, you come up with a few differentials and how you'd manage it, but there were a few tricky questions which I wasn't expecting. One of them was, what's the prognosis for this condition? And they kept asking us that for almost every single scenario. And I thought that was kind of peak because, the patient is right there. And the other thing was for the suturing, there were some kind of tricky questions. They were asking me about lidocaine and what's the maximum dose you can administer. And I didn't know that off the top of my head.
So information that you should actually read that the university gives about practical skills is right here. So these are all the practical skills we were sent, and read what is in other considerations. And then I had no idea that we needed to know about local anaesthetic doses.
So the main resources that I used to prepare were Geeky Medics. So like their explanations of how to do the examinations, their checklists, the videos. I even combined with a few people when we got their like bundle with like a lot of their stations that you can go through. That was actually pretty helpful. Somebody convinced me to get an OSCE Stop subscription, which I really regretted because I didn't use. I didn't really find it very helpful. But I'm not sure if that's just because I already had a resource I preferred. And then just getting notes from the older years in the Google Drive. They had all of the annual reviews, which was so helpful. It made a big difference. But yeah, hopefully that was useful to you guys. That is all from me today. I hope you enjoyed the video.